We're going to discuss the technology of silhouette thread, the unique technology of cone threads. So, aging, it's a physiological process. There is no chronological timetable for aging. We all age in different rates. We all age in different rates. So, if we decide the aging process happens during the bony changes with time, it affects all the soft tissue layer overlying. So, for example, the bony changes happen in maxillary bone, the maxillary retrusion. It affects the projection of the anterior face. Also, it deepening the nasolabial fold. It increases the distance between the nose and lip, and it's also rolling in the upper lip. Also, the same thing with the lower third of the face. The angle of the mandible, also, with time, it loses the sharp angle of the mandible. So this one also affects the jowl. So aging process, it affects all the layer overlying the bone. Let's say the fat. We have two kinds of fat, the deep fat pad and the superficial one, according to its location from this mass. The deep fat, the aging process of deep fat is just atrophy of the deep fat due to highly anchored to underlying structure. So it just deflated. So that's why if you want to reverse the aging process in the deep fat, it's better to inject deeply. So in my opinion, deep injection of filler or volumizing the area with deep injection is better solution than injection superficial. While the superficial fat, it's different. It's hypertrophied, so it's slippage down. So if you wanted to correct, to reverse the aging process, we should lift it up, okay? We don't add volume because it's become heavy with time. So if you wanted to lift it up, this is the role of threads. So the thread, from the beginning, we should agree, it's placed in the hypodermis, so it's placed in the subcutaneous fat. But in which direction we should put our thread? The vector of lifting. There's no way to lift it up. Why? Lift it up vertically. Why? Because the aging, it doesn't happen vertical direction. Why? Because we have something called ligamentary system. Kotofana in 2019, he described the true ligament, the bony, the osteocutaneous ligament, which is 4 ligaments started from the temporal area and up with the mandibular ligament. So these things, with time, it just loses its strength, so it keeps the skin in its position while it just moves obliquely. So the direction of the lifting should be placed obliquely, not vertically. Our device today we are talking about is the Silhouette Soft. Silhouette Soft has 3 kinds. It consists of thread of poly-L-lactic acid with cone inside. The cone manufactured by poly-L-glycolic acid. It has 3 types, one of 8 cones, so it's bidirectional cones. Each side there is 4 cones, so it's 8 cones. Also there is 12 cones, each one there is 6, and in the 16 also there is 8 in each side. The length of the threads is between about 30 centimeter. It has also connected to 2 needles, so it's double needle. 2 needle, the gauge is 23 gauge needle. How it works? This is the thread. This is the thread. There is a cones inside. This is before insertion. So when you insert the thread inside the skin, the subcutaneous fat, it goes just toward the fat from the small to the large end. Then it's inserted inside. So this is after insertion. After you insert the thread, so there is stretching in the tissue compression. So the thread will move, the fat, the subcutaneous fat will move from the small end to the wider end. Then the tissue trying to back to its normal position because it is down. So it tries to back its position. When it tries to back to its position, it faces the cones. So it loaded inside the cones. So this is the technology that make the silhouette different from other kind of threads. When you use the barbs, and there are a lot of difference between the barbs and the cones, but one of the things, this is the surface area. You can see the surface area of fat inside the cones is different from the barbs, because barb is just two barbs, or even more than two, but the surface area of contacting with the subcutaneous fat become less. So while the cones, it is 360, so no way to avert the fat. So this is the thing that make the silhouette just appear longer duration and give more power lifting. Okay, so this is, as we said, the tissue just go in the opposite direction inside the barbs. I don't want to talk about the difference because I think we don't have that much time, but we'll talk about the technique. When we want to lift the face, we usually target the mid and lower face. This is the nasolabial fat compartment, and also this is the superior jowl, and this is the inferior jowl. So, as we said, during when we talk about the line of ligament split the face in two parts, the mobile zone and non-mobile zone. So this is the line of ligament. Medial to it is the mobile area where we have expression when we smile, when we're moving, when we chewing. This is the mobile zone, while in the lateral to the line of ligament there is immobile zone, and this is the area when we want to fix the thread. So, as we said, there is cones inside the thread. So always keep the last cone in the fatty compartment you want to target. So this is the fat compartment. Nasolabial fold, نخلي بيه الcones آخر واحدة بداخلها superior jowl and inferior jowl. Then we measure the distance to the entry point and the measure distance to the exit point, and we will see it in the practical session. So this will be the vector of our lifting. As we said, the lifting power should be, the lifting direction should be oblique. No way to lift vertical, because you will affect all because this is not natural. Even when you do facelift, for the plastic surgery, when they do facelift, they don't lift it vertical. It's always oblique. Okay? Because this is the natural process of aging. The fat is going from up in an oblique way, going down. Okay? So, it is a very effective way. It is a very good kind of threads that you can use to get a good result with your patient, but it's all depend on your patient. The patient selection is the most important thing. So if you want to get a good result, you should consider the kind of patient you want to use the thread for. Patient with a very heavy tissue, with thicker skin, heavy, thick fat layer, no way to lift it with the threads. Patient in opposite with a very delicate skin, atrophied fat, there is no fat to anchor it, so there is also, you will not get good result. So it is for mild to moderate sagging of skin, and this is in general. So that's why some patients, they see result with thread, the other will not see the result with the threads. Okay, so now we will start with the patient, and we will assess her case. I saw her before. فاعتقد هي راح تحتاج نشتغل لها بالميد واللور. عندنا النيزو ليبل فات كومبارتمنت واللور. يلا استريحي. خليني بس احد يلزمني المايك. ماكش موضوع بسيط وسهل، بس تشكت الابره وانتهى الموضوع. يعني قد ربع ساعه، بس مسحوا لها الآن. اي خل معي، اي مسحي لها كل شيء كامل. اي راح اشتغل منك. طيب خلينا بس جلافز.
هذه استرايل.
اي بعدين نلبس الاسترايل.
ماكو.
نعم. اريد الماركر. هذا ماركر. ها؟ بس هي شكت الابره. So this is our patient. اللي راح نسويه هسه راح نشتغل على الميد واللور بارت. مثل ما قلنا احنا عندنا بدنا نستهدف السوبرفيشال فات كومبارتمنت. سو سوبرفيشال فات كومبارتمنت بالاريا هنا هي عندي النيزوليبيال فات، وعندي بالجول عندي السوبيريور فات بالجول، وعندي الانفيريور jowl fat. Okay, so this would be our target area. من هنا اسهل؟ يلا اوكي تمام. جود. بس من راح نشتغل لازم بالعكس. فهذا النيزوليبيال فات كومبارتمنت، هذا السوبيريور جول، وهنا عندي الانفيريور جول اللي يسبب لي الماريونيت لاين. اذا مثل ما قلنا احنا عندنا كونز، الكونز نختارها according للسايز الاريا اللي بنشتغل بها. فيوجوالي you can use both, but usually I use in the mid face I use the 8 cones here, and in the lower face I use the 12 cones. ليش؟ لانه الاريا عندي اكبر هنا. فمثل ما قلنا ال 8 cones احنا دائما نشوف التارجت مالتنا هو المسطره، التارجت مالتنا هو اللاست كونز اللي بالفاتر راح نخليه هنا. فهنا أنا عندي اللاست كونز راح يكون، وهنا راح يكون عندي اللاست كون. اعطيني ماركر ثاني، ماركر ثاني اكو؟ ما بيها وصل. هنا راح يكون عندي اللاست كون بالانفيريور جاول واللاست كون بالسوبيريور جاول. نريد الرولر ورا ما نخلي مكانات الكونز اللي نعرف هي وين راح تكون. ذاك الوقت نستخدم نسميه الاوتو بايلوت، اللي هو مجرد تخلي الرولر حتى تعرف وين الليفتنج مالتك راح يكون. الرولر وينها بالتشيز؟ هاي. فويا الخيوط راح تجي رولر. هاي الرولر بها القياسات. هنا أنا عندي 8، خلي لك الأربعة كونز من الجهة هنا. Okay, this is the 4 cones here. So this is our last cone here. Usually we exit just 1 centimeter behind the last cones. So this is our exit point. Our entry point would be here. شوف الماركر الثاني. ماركر اي ثاني، اكو واحد ثاني. هذا الانتري بوينت مالتي، شوي لف عليه. وهذا راح يكون الاكزيت بوينت. هنا راح يكون الاكزيت بوينت. So entry, exit in two sides, medially, laterally. Okay? The same thing we do in the lower jowl and superior jowl, but with the 6 cones in each side. So هذا راح يكون our last cone. This is our exit. So we check the direction of lifting. As we said, it's always oblique. So this is our entry. And this is our exit. The same thing here. هذا last cone. الاكزيت بوينت مالتي راح تكون 1 سنتيمتر behind. الانتري موجود هنا. أنا عندي الماركر بدي اشتغل. ماركر بدي اشتغل.
حاولي نغطي بايدك قبل ما تدخل.
شوي اضغط عليك.
يأذي. So this is حتى لو تجيبي لي قلم جاف، جيبوا لي قلم جاف اي شيء، قلم اي قلم. ان الماركر بدا يشتغل زين، ف نحتاج الماركر. هذا راح يكون الاكزيت بوينت مالتي. فان جنرال اتس فيري ايزي بروسيجر. النيزوليبيال فات كومبارتمنت اخلي عندي اللاست كون مالتي على الرولر، موجوده مرسومه هي على الرولر. راح نخلي اللاست كون بالنيزوليبيال، اوكي. نطلع 1 سنتيمتر بيهايند حتى انه نخلي ان من نطلع اذا طلعنا بالنيزوليبيال فات فالكون راح يطلع برا السكن، فاحنا نخلي اللاست كون وعنطي الاكزيت برا حتى الزايد نقصه من الثريد. بعدين الانتري مالتي موجوده هنا أنا مأشره، وبعدين اجي اسوي الاكزيت بوينت مالتي بالتمبورال اريا اللي هي فيكس زون. سو ذا سيم ثينج انا هنا راح ابلشها. هذا الانتري مالتي، هذا الاكزيت 1 سنتيمتر behind to make sure that the cones will stay inside the fat. هذا 12. هنا راح يكون عندي
ليش تو؟
ما ليش تو؟ جيبوا لي اي قلم هذا المباراه. اي ما يحتاج مايك هسه انا احكي. اوكي هذا ال8 وهنا راح يكون عندي الاكزيت. نفس الشيء ال 12 من جهتين. هذا ال 12 هنا راح يكون عندي الاكزيت وهنا راح يكون عندي الاكزيت، وبالجهتين راح انطي الانتري مالتي. الانتري راح تكون بالميد لاين ويصعد لي فوق. بس احتاج ماركر هسه جيبوا لي حتى يبين لكم لانه بدا يطلع واضح. شكت ابره بس. ال8 للميد فيس ولا؟ ايوه. زين. So this is the fat. هذا ال8 cones. هسه راح نبلش. هذا ال8 cones. Here is my exit. 1 centimeter behind the last cone. Here is the entry point. And with same measure, here will be my exit point. This is for the 8. For the 12, this is the superior jowl. This is my exit. This is the inferior jowl. This is my exit. So for the superior jowl, this would be my entry point, 0. And this would be my exit, here. The same thing with area here. This would be my inferior jowl, this is my exit. Entry would be here. Exit also would be here. Okay? راح يصير نفس الشيء. ال8. This is exit point. This is entry, and this is the exit. Bit 12. This is my entry for the upper jowl and inferior jowl, and this would be my exit. Usually with time you will not need this one. You will just put because the length you can measure on the face. Yeah. انطيني الكحول على الجهه الثانيه ما راح نسوي بعدين. احنا خلينا نشتغل على هاي الجهه الاوضح. هاي الجهه اوضح. Actually, it should be a more sterile set. هذه ال8. افتحي لي ال8. طلعي هذه. So the first pouch is not sterile. So عملنا أكو. So it comes like this. This is the silver one. It's not sterile. The other one also is not sterile. Only this part is the sterile part. Okay? So this is the 8 cones. طبعا صعب انه تشوفوها هسه هيك بس اعتقد بالكاميرا خلي لي هذا شيلي هذا مثل ما قلنا هو يجي تو سايد عندنا باي دايركشنال كونز تبين بالطرف اي باي دايركشنال كون اكو عندي 2 سنتيمتر فري كونز اريا وعندي 4 ان ايش سايد تيجي وياها نودز بين وحده وبين كون وكون اكو نودز هاي النودز فكرتها انه نخلي سترينث از ليس از وي كان على الثريد نفسه يعني اذا صار مايجريشن او اي شيء باي كون واحد فراح يصير على الكون نفسه لانه مفصول واحد عن الثاني اكو كونز فهاي تجي شويه لوز لان بالستورج اذا كانت تايت راح تول بريك داون فاحنا نجي بس نسوي لها تايتنينج اوكي so this is our threads اريد النيدل 18 افتحي لي اياها اعطيني هاي الجهه خلاص يلا لفي لي وش من هنا نيمي لي شويه نزلي لي اياها تقدر نعم نزله شويه مفصول مو لازم اشتغل هيك والجهه الثانيه هسه ها ما تعرفين راح تصير شكة ابره هنا موجوده اوكي لفي لي الجهه ايه تمام طبعا you may see maybe the patient has some pain لأنه there is no anesthesia they didn't bring anesthesia so okay so expect that يعني she said if I hurt I will leave so close the door and so this would be my entry is it clear this is my entry point we just pinch the skin and we use the needle 18 gauge we just enter the skin. We just crossing the dermal layer, so we are in the subcutaneous fat. As we said, we tighten the thread, then we insert our thread. There is, if you can close, if you see there is black line هذا هو الميجرمنت اللي حتى تعبر جست الديرما لاير انت بالسبكيتينوس فات. So you are in the subcutaneous fat. We just move slowly. So now we are in the our exit. We're just out. So we inserted the proximal part. The proximal part هو السسبنشن بارت. احنا شلنا هسه السبكيتينوس فات من هالجهه هاي هنا خليناه بداخل الكونز. Now we should fix it laterally. بالفعل goes. So this is we are in the subcutaneous fat now. We're just moving. Laterally, usually by anatomy, the superficial fat above the zygomatic bone, it's more superficial than the lower part. So if you 5 millimeter in the medial side, so you should be at least 2 or 3 millimeter laterally. So how do you know? Because we know there is a superficial temporal artery and vein here, and we are afraid of hematoma. By the way, if you hit it, it will be just hematoma and you have to compress it, nothing to do. But to avoid this, we just check always our needle. We call it finger test. We can pass our finger under the needle, so you are safe. Just move, still superficial, still superficial, still superficial, still. Now I reach my exit point, so we out. Usually when you move in the subcutaneous fat, there is no pain. Actually, the pain only in the entry and exit now, because we didn't put anesthesia. But with the anesthesia, there is no pain at all, and it's a good marker to know if you are in the right plane or not. If patients feel pain, so you are either superficial or deep. So here is our thread. This is the first one. So now we will insert always the second and third one. I personally prefer to start medially, then fix laterally. There is no explanation. Sometimes some people ask if we can start laterally or not. This is my opinion. I think it's better to start medially than start laterally. Yeah. This one will start with the second thread. اعطيني بس اول شيء. يلا اوكي افتحيها. هذا 8 ولا 12؟ هذا اريد 12. 12؟ ايه. سكند ثريد راح تكون مالتي الانتري ايضا مثل ما اشرناها بالماركر. السكند بوينت الانتري مالتي انتري بوينت عندنا هو بالثريد بصوره عامه بالسلوت 3 بوينتس اوف، وحده انتري وحده اكزت وتو اكزت. فالانتري راح يكون منها راح نمشي بالجاول فات باد، ندخل الثريد ميديالي وي هولد ات ذن وي فيكس ات. Yeah. So this is the thread. طبعا كل باوتش يجي ب 2 threads. بس شوية ممكن. Again, this is a thread, 223 gauge needle, 12 centimeter. هذه الزون اللي بالنص اللي هي 2 centimeter cone freeze area. And these هذا لأنه ال 12 and then 6 cones in each side. So we tie the knot like this. By the way, don't tighten it like this because you will break down the thread. Just hold it like this and tighten it by your thumb, gently. So again, this is my entry. Here I cross just the dermal layer, now in the subcutaneous fat. Try to take your time for widening the area of thread, of insertion, because this will make the life easy for you if it is wide opening. Sometimes it's hard to find the entry point, so you can drag your needle on the skin and you fall down. بس شوي أخر الماء، خلي الماء صفح مو بوجه. So here is in the entry point. Now I'm in the subcutaneous fat, you can check. This is my exit. I just crossed the area here. And here is my exit. Always check before you go out. You check. You are in the subcutaneous fat. There is no dimpling, nothing. So it looks straight. So gentle movement. Just خلي الكونز go inside. هذا. صحيح لي. بس شوي نعطي مجال. Again, this is my entry. صحيح. صحيح. So here is my entry, same. Now I go more superficial. If you lose your needle, so you are deep. So now I cannot put my finger, so I think I'm deep, so I just pull it out and then re-enter again. Here is my exit. Actually, I didn't go up so much because there is no anesthesia, so she will feel in pain. So that's why I lose 2 cones. Okay? بس لأنه ماكو anesthesia, she will be in pain. And she threatened me already. If I in pain, I will leave you there. هذا السايد يبين عندك أكثر؟ هذا السايد يبين تقدر تطلع لي هنا؟ لفي وجهك من هذا ممكن؟ لفي وجهك.
زمن.
تعي عليه شوي تعي. إيه. أيوه تمام. I think this side is clear. So what we do usually, we just lift the thread in the opposite direction. Also, the lateral one. As we showed in the slide, we just loaded the fat inside the cones. Yes. It's fine. Yeah. خلينا نسوي the third one. Now I'll put the third one. يلا. لا نفس هذا نفس موجود. هذا 12. اسحبي ده. Again, this is the thread. 6 cones in each side. So just tighten it. Don't hold it like this. It will break down. So tighten it like this. Yeah. شيل. We just move in the subcutaneous fat. Goes. ما احتاج اني الآية. احتاجها بعدين. هذا الانتري. Just don't go so deep. When you feel needle doesn't move like this, you are in the subcutaneous. But if you go more, so it will be like darts, no way, they are deep. You are the muscle. So just pull it out. It should move like this. Superficial. Again, I didn't go out, I didn't go up so much because she's in pain. But when you do anesthesia, you give the whole area. You float the area with the anesthesia because actually you don't know from where you go out. So you give the anesthesia for the whole area. Patient will not feel any pain at all. So it's 3 steps. First one is insertion the thread, entry point, medial insertion, lateral fixation. Second step is to tighten the thread. So as we said in the slides, هذه الكونز, this is the last cone. It's open. So I want to load it with fat. So you do massage like this, upward direction, and from the exit, another lateral, another. From the exit, you do it just medially toward the entry point. Okay? Because it's cones, there's fat, I want to put the fat inside. The same thing with the lower. The same thing with the... Here I already lose 2 or 3 cones, so this is because I didn't go out quickly. زين نعطيني السيزر. So, as you know, you should cut the extra. This is if you suspect there is a cone just next to the skin, it's better to take it out because if you leave it very superficial, the dermal will be fibrosed. So a patient will come after 2 weeks in severe pain. Okay, إذا إجاك مريض بعد أسبوعين severe pain, so you should look for the cone. You place 1 cone superficially, especially on the exit point. لهذا إذا تشوفه يعني حسيت إنه الكون صار قريب, better take it out. It doesn't matter. We still have 3 or 5 other 5 inside. خلص.
خلصت الصفحة.
Come. So we already lifted the lower face and the middle one. تقدر نقعدها شوي؟ وايب ات. ساعة ايش هسه؟ خلص. The good thing with this thread is patient can go immediately back to their work. There is no bruises, nothing. If you are working in a correct plane, you will not face any bruises or anything, so a patient can go out. راح احكي على بعض الكومبليكيشنز اللي ممكن تصير لانه when you use a lot of threads you will have some complication. One of them is the pain. Pain after 2 weeks, that means there is 1 cone superficial. Second thing, sometimes we have dimple in the entry point. Why? Because if you enter and you are enter with 2 needles in different direction, one medially, one laterally. If the medial one you are in the correct plane, let's say, the other one little bit superficial, 1 millimeter superficial. So there is a dimple inside. This will go by itself within 5 days. If you wanted to remove the dimple immediately, you can use the thread اللي قصينا. You can do subcision. Just release. قصي هذا Caesar. Use the other end, the other blunt end, okay, not the sharp one because you will break down the thread. and go to the dimple side and go. I will not do it, but she's already, okay, so go directly and just subside the area. You will release the threads, it will back in its position. تمام. The more thread you put, the more lifting power. ليش؟ هذا don't put one thread for a patient. Sometimes they ask for, I'm talking about the silhouette especially. Sometimes people, they come, I just want one, it will not see any result. So they will blame you, blame the thread. تدرين قاعدة حتى نشوف الرصد؟ قاعد ليها أكثر؟ نقدر ناخذها هيك شيء؟ خلاص نقدر ناخذها من قدام؟ So you'll see this side, it's more upward direction. لف هنا. Usually the average number of threads I use in my clinic is 4, 2. But if you wanted to use, be generous with the patient, do. If they can afford it, because it's not cheap. Okay, yeah, نزل. I will start with the other side. If you have any questions, so you can ask while we're using. تمام، اوكي. لفي لي وجهك من هناك. نزل يا بعد، نزل يا. نزل. خلاص. يلا نيدل. 8 واحدة 8 واثنين 12. 8 عندنا اوريدي واحد مفتوح. So it's very easy. Entry point. Pinch the skin. Entry point. There's a scar already here, so it's fibrosed. So take your time while widening the area of entry point, because you wanted to put the 2 needles inside. If you put 2 needles in different sides, you will have dimple. So this is the thread. Tighten it. خلاص. Here is my needle inside. Just move medially. I expect to see some resistance because of the fibrosis skin. There's a scar now, it's fine. We just cross the nasolabial. We are out. It's very quick procedure and very effective one. صحيح. So also, this is my entry. Needle. تاني بعد. يلا ايه. So this is my entry point. You will feel when you pass the dermal layer, so you will feel it. You just pass small resistance. So this is the medial, this is the entry point. We start medially to fix the fat compartment you want to lift. Then we anchor it laterally in the temporal fascia. As I mentioned, the difference between the barbs and cones, the barbs have very smaller area than the cones when you want to fix. So the more surface area, the more lifting power. Also, in the manufacture of barb, they take almost 1/3 of the thickness of the barb itself to create the barbs itself. So it's one thread, and they cut 1/3, so they have barb. So the strength of the thread itself has become less, while the cone is just floating in a free thread. There is no cutting, nothing. So also the power of the cone's technique is much more than the barbs. Always check you are in the same line. So we don't need anesthesia, only from the exit for entry. Some kind of threads, they just put the anesthesia the whole way of the thread. Actually, if you put like a tumescent the whole way in the thread, you do hydrodissection of the skin between the fat layer. So there will be no anchorage. That's why they encourage, if you want to use anesthesia, use it as much as you can, just to keep the fatty area just in one part, compact. You don't hydrodissect the area. This is our entry. We are more superficial in the temporal area. You can use the cap, just push it from here and then go out. Again, I didn't go so much up because there is no anesthesia. Yes. Then he goes. So this is the dimple I talked about. هذه الدمبل ما ادري اسمها تبين عندكم يمكن. This is the dimple. You can just release it. Later I will release it for you. خليني بس الجهة الثانية اروح. اعطيني. This is our entry. Thread. Always don't forget to tie the thread. Hold it. Tight. We are in the subcutaneous fat. Just slide, push it. If you feel resistant, you are not in the right plane. So just slide. They call it like a knife in a butter. So you just push it. Again, there is no anesthesia, so she feels pain. You see, she feels pain when we do the entry and we do the exit only. All the way there is no pain because you are in the right plane. There is no superficial nerve in it. So you enter the side. This is the entry, now in the subcutaneous fat. Very superficial. I'm superficial on purpose because the superficial fat here is much thinner than the lower one. So now I insert 3 threads. The second step is to tighten it. You have to tighten it, but gently, because if you don't tighten still the cone, the fat will be here, the cone will be here. It's not inside. I want the fat inside the cones. If I exit from here, I'll expect to have one cone out. The same thing happened on the other side because now I might expect to have one thread out. Why? Because I didn't go up so much. Now I feel there is a cone. You see the knot? هذا الدمبل هسه راح نشوف. الدمبل if you leave it it will go by itself لأنه هو التشو نفسه راح ينزل فراح يبدأ يفتحها لأنه ما يفتحها. يلا مسحين اياها. اعطيني النيدل بس حتى اسوي افتح شو اسمه. لا اي قصيه من الخيط. خلصت.
عفوا دكتور. السلام عليكم.
السلام. يا اهلا وسهلا.
استاذ بتاخر بس حبيت نقطه الدخول كانت الوسط عندك.
اسرع راح افتح الدمبل بعدين اسوي سمري سريع عنها بس كحول مسحيها كلها بس الدمبل بالنص
فتحتين بس.
اي so this is our dimple we just release it you can move on all sides. Actually, there is no anesthesia, so she's in pain. Become more superficial. You see? So, as we said, with time, the dimple will release by itself, but you can release it sometime during the procedure. So, in summary, we have three kinds of threads. The most popular one, we use the 8 and 12. 8 cones, it means that it's bidirectional, so 4 on each side. We started with entry point, okay? What we do, we target, we mention the area we wanted to target. The fat pad, let's say the nasolabial fold. The nasolabial fold, we put the last cone, and then we use the roller. اعطيني الرولر. الرولر هي مرسومة عليها الكونز. We use the last cones. We just exit 1 centimeter beyond. The entry point would be in the middle, and the exit also we measure 4 cones, and the exit 1 centimeter also. The second step after insertion is just loading the fat inside the cones just to fill it with the cones, and then the other direction also, and then cut the extra thread. Okay? So if you don't have questions, so this is how we do the threads. You can see قاعدها خلينا نشوف. There is no bruises, nothing. The only thing that she has pain because we don't have anesthesia, we didn't put anesthesia. And by the way, we did 6 thread, we didn't put any anesthesia because we didn't bring it anesthesia. So هذا سكار عندها المريضة. The dimples, it go by itself. Within 3 days, 4 days, it will release. لا. No. You can release it. You can insert. Why it happened? There are no 2 threads, 1 different layers. So what we do is just subside around the thread so it will pop out. So there's nothing, but it will go. Actually, I didn't do very hard now because she's not in anesthesia. I didn't put anesthesia, so I don't want to make her more pain. Okay, so you see now the difference?
Just topical.
I use injection. Injection. Entry point, I put just 0.2 lidocaine. Exit point 1.2, exit point not 0.2. Actually, here I become more generous because I don't know where I'm going out. So to prevent any pain, so I fill the area with the anesthesia. Okay?
In the timber. the end point for all thread
in the temporal fascia.
and the temporal thread. All.
And
all
all. Why? Because this is the line of ligament.
Yeah.
The area medial to it is mobile area, while the area lateral to it, it's fixed area. So you want to anchor the thread in a fixed area. So we hold. Wait on.
thread and coring in the temporal.
Always anchorage in the temporal fascia,
That's it.
whatever kind of use. خلصنا هيك. تمام؟ Yeah.
What about difference between video and the silhouette here? for
I
lasting?
mentioned the silhouette, the cones. I think no, they have another. الكونز السيرفيس اريا مالتها الانكرج اكبر وبالتالي اللودينج اوف فات يصير اكبر وبالتالي الليفتنج باور اكثر. هاي 200
الوقت duration يعني هل يختلف؟
ما هو انت اذا كان عندك ليفتنج باور اكثر فاذا معناته الديوريشن رح تبقى لك نتيجه اطول. الشغله الثانيه ذاتس نعم. الشغله الثانيه